Yeah, sir, please go ahead. So please go ahead. We are live now.
I hope we are audible. That we'll have today on TB and lung health. Let me, in this pandemic era where everybody is talking about COVID only, let me bring to your notice that about 10 million people all over the world, are adding with tuberculosis every year. And out of this, there are 26%, that means 2.6 million people of tuberculosis, which are being added still in India. In this present era also, there are 2.6 million people and about 1.2 to 1.4 million deaths occurring every year because of tuberculosis. And I'm quite sure the numbers would have been much higher had tuberculosis got the same kind of attention that COVID is getting. That means if the surveillance was to the level which COVID is being surveilled, I'm quite sure that we might have picked up much early cases of tuberculosis, and we would have been close to eliminating tuberculosis in the 2 years, the way we have proceeded with COVID. Coming to that, I think there are a lot of positive things which have happened in the last decade. And to this, I must say that the union, which is based out of Paris, has done a phenomenal job in spreading the awareness about TB, about giving us guidelines for the management of multi-drug resistant tuberculosis, starting centers where free distribution of tuberculosis medicines are being given. Also, the union has very rightly tied up with the Ministry of Health and Family Welfare and the National TB Eradication Program. And USAID has also helped us a lot in trying to eradicate tuberculosis from our country. And in 2019, our Honorable Prime Minister Modi ji, understanding the importance, the problems that tuberculosis causes, it is a multifactorial disease which almost involves every organ of the body, right from the brain to the heart to the liver and intestines, spine, joints, everything. It is very, very important that we diagnose and treat tuberculosis because it is truly a very debilitating disease. So, corporate India, along with the union and the USAID, started this I Defeat TB project in 2019, and with a very ambitious target of eliminating tuberculosis by 2025. And I think we were going very strong in that. We were trying to achieve our targets. And then we were upset because, TB took a back burner when COVID came into place and everybody started talking about COVID. Fortunately, today, COVID is under control. And I think the time has come that we have to focus on other non-COVID problems. And TB remains number one. So my request to all of you is that more and more corporate people should involved. And I think the initiative today from ASSOCHAM is that if more and more corporate people, corporate hospitals like Gangaram Hospital and other private hospitals join up with the union, and we can spread the awareness about tuberculosis, and we together aim toward an early diagnosis and early treatment of tuberculosis so that we can achieve the target of eliminating TB by 2025. With this, I will close my inaugural talk to all of you. And I would now request my colleague Upasna ji to talk to all of you. And Upasna ji is our coach here in ASSOCHAM for healthcare, and she is a leader who talked a lot about empowerment of women. She heads a great institution, and I would let Dr. Upasna talk about the initiative of ASSOCHAM. Upasna ji, over to you.
Thank you, Dr. Kalhan. Good morning, everyone. And I am really thankful to ASSOCHAM that they have given me this opportunity that I can listen all the experts and I can share my views also. Because TB is a problem which India is facing from so many years. And unfortunately, we are not able to eradicate it right now. But the way now our government is working and other institutes like Union and USAID, everybody is now focusing on TB. I think tuberculosis will go away and it will be like polio that we are hardly finding any cases. If we talk about tuberculosis, it's just like corona. It is also spreading from droplets. But we are so much worried about corona. If and everybody is wearing mask. If we have done it before for tuberculosis, because TB has lots of different kind of TBs, but most infectious is lung TB. So when somebody is coughing, sneezing, so other person is getting it. We have lots of expert in this field, but I would like to tell you that we have also taken pledge, because ASSOCHAM asked us to, as a corporate pledge, we have taken that. But before this, today we have with us our panelist, Mr. Chandrasekhar Sibbal from Fuji. When they approached me for their new X-ray machine, which is supposed to detect TB in very early stage, I adopted then and there only, because I really want to help society to detect TB at early stage. Because if you are detecting TB in early stage, it is really very easy to cure it. And there are few programs governed by Government of India, where they were telling to you that if you are having cough for 6 more weeks, then it could be TB. And this ad was run by our Amitabh Bachchan. I think such kind of awareness is actually important in society. So common man should understand how they can feel, and they can go for a screening that they could be suffering from tuberculosis. With these words, I am welcoming all of you, and I am really thankful to ASSOCHAM as well as all my panelists that they have given me this opportunity. Now I am ready to listen all the experts. They are going to tell us more about this, and hopefully very soon we are going to eradicate TB from India. Thanks a lot.
Thank you, Upasna. I think you have made a very, very important point that we have to spread awareness about tuberculosis. Tuberculosis should be advertised through social media, through television and other channels, and we must make people aware about the tuberculosis as we have made them aware about the COVID appropriate behavior and about COVID and so many other things. So today, we are very fortunate to have Dr. Kuldeep Singh Sachdeva amongst us. Dr. Kuldeep Singh Sachdeva at present is the regional director of the union. He also has more than 32 years of experience that he's worked with the ministry. He's worked as a deputy director with the National TB Eradication Program. He also has immense experience with the HIV program. And I think we are very fortunate that he has joined the union and now heading the Southeast Asia in creating awareness about the TB program. So without wasting any time, I request Dr. Kuldeep Singh Sachdeva to give his inaugural talk, the work the union is doing and how we can take the advantage of associating with him and spread the awareness through the ASSOCHAM to the corporate world and the people at large. Dr. Sachdeva, sir, please.
Thanks, Dr. Sudhir. All other esteemed speakers and panelists who are present in the virtual meeting today. So it's my pleasure to welcome you all to this corporate TB summit on TB and lung health. We are also very happy to be partnering with ASSOCHAM, supported by USAID, to take this initiative forward. Some of you may be knowing about union, but let me tell you that union is an international scientific organization founded in 1920, more than 100 years of existence. And we address diseases of the poor, develop evidence for the national programs and governments to take it to scale. And we are specifically focused on lung health, TB, HIV, tobacco control, amongst other areas, and work in close partnership with the ministries of health and other stakeholders. Dr. Sudhir already praised you about the burden of TB in the country and how significant this problem is. In fact, before COVID came, TB was the only infectious disease in the world which caused maximum number of deaths, close to about more than 400,000 or 4 lakh in this country alone. It's almost translates into one death every 1.5 minutes in the country. We have been very proactively involved with the governments in the TB elimination efforts. The very fact that we are today talking about TB elimination is a huge leap of faith in both in the scientific community as well as in the political and bureaucratic circles that we can eliminate TB. This was never in the public discourse for last 20,000 years. We say TB is disease as old as 20,000 years. It is this moment in the history that we are now talking about TB elimination. The scientific community is supporting the idea of TB elimination, which means there is an evidence that we can go and eliminate TB. What will it take to eliminate TB? So like we have seen elimination of many other diseases in the country, the recent one being polio, it takes involvement of all stakeholders. And involvement of corporate sector is one of the major step in this direction. Thanks to ASSOCHAM, Dr. Sudhir, and other partners supporting this initiative. So we are fully committed to align ourselves with the clarion call by Prime Minister of India, that is to eliminate TB 5 years ahead of the Sustainable Development Goals, which is 2030, and we have set a target for ourselves for 2025. So the corporate TB Secretariat was established at the Union with the support of USAID in 2019. We have made rapid strides since 2019. I mean, in less than about 2.5 years time frame, we have 140 corporates already aligned with the vision of TB elimination and working closely with the union and the national government. Through this involvement of the professional associations, the business association, we now wish to take it to scale, considering the urgency, and we are very close to the target of 2025. So a lot of initiatives have been taken in this direction, which many other panelists will talk about it. But I'll echo the same sentiment which Dr. Upasana echoed, that we look at TB elimination in near foreseeable future, and we all want to be part of the history that we contributed to that TB elimination and be proud of it. With this, I wish this consultation all the success and look forward to sharing my views in future discussions and also in the panel in this meeting. Thank you. Over to you, Dr. Sudhir.
Thank you. Thank you so much, sir, for your words of wisdom. Today, we are very fortunate to have another big person with us. We have amongst us Ms. Sangeeta Patel, who is a US Senior Foreign Service Officer, who has been with us since July 2019. And before this, she has been working with USAID since 2000, and she's worked in the Southeast Asia region with Pakistan, Namibia, Zambia, Armenia. And, she has been very passionate about the work she has been doing in India. She is a very qualified person. She has a master's degree in strategic studies from the US Army, and also has a master's in public health in maternal and child health. And I think we are thankful to Ms. Patel and USAID in general that, they have joining hands with the National TB Eradication Program to help us fight the menace of TB in our country. So over to Ms. Patel, please go ahead and tell us about the USAID and how you are contributing towards the common cause of eliminating tuberculosis in our country. Thankful once again on behalf of the all countrymen to help us in this initiative. Thank you, ma'am. Over to you, please.
Thank you so much. And it's always humbling to follow Dr. Sanchdeva, because after you talk about, every minute and a half a death occurring in TB, and then I speak directly afterwards, I always have to take a pause, a very humbling pause, because I have to acknowledge, first of all, thank you. I'm very grateful for this corporate leadership summit organized by the union and ASSOCHAM, especially under the I Defeat TB project supported by USAID. On behalf of the United States Agency for International Development, I again say I'm humbled, because I know that, especially now, in the wake of COVID, and still while we're battling with this very challenging context, we're also dealing, of course, with tuberculosis and the continuing challenge that COVID has had on even the delivery of TB prevention, surveillance, treatment, and care. Through successive lockdowns and implementation of public health guidelines, as well as even trying to grapple with the traditional management of TB and the complexity of supporting patients throughout these dual and even overlapping contexts, it's becoming overly apparent that even the support that we've provided through USAID over the decades, right? And even the support that the government's own program has been providing specifically to eliminate TB, even ahead of global targets, it's very clear that a lot of backsliding has occurred. And I think that I'm here to acknowledge even that while we work across multiple partners, NGOs, even at an implementation level with state governments on the science and also on publishing through research and with academia, this what we've achieved, I think we also have a huge challenge ahead of us. Involving the private sector is not only critical, but it's actually it's one of the important areas that we just cannot neglect. With the kind of devastating impact that TB has already had on families and households and communities, as well as even the challenges that COVID has brought to the entire health system, let alone to the economy, we need corporates, and we need them now more than ever to play a critical role in supporting India to eliminate TB, but also to really rebuild and regenerate the income and the really the support that's needed for the workforce. Corporate TB pledge that USAID launched in April 2019 in partnership, of course, with the government of India's National TB Elimination Program is just one such means for us to provide those stopgap measures that are needed and really the flexibility that's needed to encourage resiliency and response from the community to the facility on up through the district and state to the national government, and frankly speaking, even beyond to other regions. India is not only bold and ambitious in pursuing an elimination agenda, but frankly speaking, you have all the right ingredients here in country, especially with the commitment that is demanded from the private sector. It's part of their corporate social responsibility, but also mandated by law to provide support. So of course, why not TB? And why not this platform where you'll not only be able to support prevention, detection, treatment, and response in TB, but also, frankly speaking, allow India to build or even strengthen that capacity to manage COVID and, of course, any other infectious disease challenges. Because we know that when we invest in TB, we know that the dividends have a ripple effect across multiple areas. And frankly speaking, those dividends will come right back to the very economy and corporates and businesses that are involved, because you'll have a healthier workforce and you'll have more supportive families and communities who ultimately also understand and share the same ideals to rebuild, to rebound, and really be more resilient. So I think from my perspective, we've created different levels of pledges for companies, and I'm sure you've heard about them or are already experiencing them directly, you know. But from silver to in making a public commitment to gold and developing a clear annual plan for TB awareness, screening, and treatment, to even diamond in championing the cause and helping others, and of course, platinum in between, and investing in your own resources in TB. All of these levels, to me, it's nomenclature really to just say you care and that you're going to and are willing to work in partnership with us to be able, especially together, to provide the information, the services, the access, and really the reach that's needed to make a difference, especially in the workplace and beyond. And that's what matters. So for USAID, this partnership has been instrumental, at least from our perspective, in being able to gain the momentum and confidence that's needed to be able to really meet many of the gaps in implementation, and also to try to innovate and really adapt and do new ways of reaching vulnerable populations which haven't been tried. So I thank you here today for coming together as part of this corporate summit, but also for allowing us the opportunity to continue to work with you. And I hope to be able to really think of new ways that we are going to work now within this context, and that we have to work if we hope to recover. So thank you.
Thank you, ma'am. Thank you, Ms. Patel, for your words of wisdom. And thank you once again, and USAID in particular, for the phenomenal work that you are doing in our country to fight the cause of tuberculosis. And I only wish and hope that the commitment increases and the aid increases, and we together achieve the target of eliminating tuberculosis from the Southeast Asia. And thank you once again, ma'am. And now it is my pleasant duty to introduce to all of you Dr. D.S. Rana. Dr. D.S. Rana is a Padam Shri awardee. He's also a B.C. Roy awardee. He is presently the chairman management board of Sir Gangaram Hospital. He actually is donning many caps. He's also on the governing council member for Palin Institute of Medical Sciences, for PGI, SGPGI. He is also the advisor to the COVID task force. And apart from that, there's another aspect of Dr. Rana I would like all of you to know about is that he's a great philanthropist, and he runs a program in his native place, that is Amirpur, where he's taking care of a lot of people who cannot afford quality medicine, and Gangaram Hospital consultants are supporting this cause. So I think it was very apt that Dr. Rana addresses and announces the partnership that ASSOCHAM is going to have and corporate India is going to have with the union in achieving this task of eradicating tuberculosis by 2025. Over to Dr. Rana, sir.
Thanks, Sudhir, for your kind words, and good morning to all of you for participating in this important discussion on the tuberculosis. We all know that tuberculosis is a disease which is preventable and curable. However, even today, it accounts for nearly 5% of all mortality cases amongst all diseases. We have made some progress over the last 20 years, and even the third cause has moved at least to fifth cause, but we have to take the lowest thing now. And it's totally preventable disease, curable disease. And we all know that Dr. Steve told you that incidence somewhere in 2019 was 197 cases per lakh in our country. But in 2021 survey, it was, even in spite of COVID, it was 217, maybe because of more awareness and population has increased. The present decline in incidence is about 3%. While to achieve the goal, target, we have to achieve at least 15%. And that is a very huge task actually. Where all of us have to join hands together. That is very important. I am very glad that ASSOCHAM and its corporate members, we are pledging today on this summit on tuberculosis and lung health. I'm also glad to add here that Sir Gangaram Hospital is a very trust-run hospital, and we participate in all preventive programs, whether they are run by national central government or state government. And we contribute from our side money and our manpower towards that, And that is what I expect from all everybody, In democracy, we always expect that everything should be done by government, That is very, very, I never think that the government is supposed to do everything, Till we people as individuals, as groups, or in the form of NGOs, we participate in not question of tuberculosis. It holds true for every person in all aspects of the progress of the humanity. So, I am basically a nephrologist, and for quite some time I am not aware of various national programs, but I am grateful to you and Payal in particular for having invited me to this discussion. And today I, in the morning, spent few hours learning all what is going about tuberculosis in the world and in India to prevent it, cure it, and I'm really very glad to learn the history of tuberculosis over the last century. And but as I told you in the beginning, it's still remains major cause, leading cause of death amongst communicable disease, and fifth cause in all disease. I'm very glad that looks very, very difficult task. Can we can combine together, we can achieve, not fully to larger extent, that the national program of eliminating tuberculosis by 2025. I'm very sure that all of us join hands together, we can achieve it. And today, of course, this is a corporate pledge, The corporates, they can contribute in various ways. Their workers, whether officers or laborers, they spend half of the time in their offices. And when we talk of corporate, we talk only corporates. I hope that we have got a lot of unorganized industries where a lot of laborers are employed and exploited. And in fact, if they get tuberculosis or some other disease, they are expelled also. They are exploited, they are overworked, and they are underpaid, So I think the corporates need to create a very good culture to maintain good health. At the same time, they can contribute a lot in creating or in building capacity, to achieve this gigantic task, So I'm glad that corporates, those who are involved with ASSOCHAM, and ASSOCHAM in particular, is pledging, or probably they have already pledged, but they are reassuring their support to this great initiative. With these few words, I would like to listen to you people. Thank you very much.
Thank you, Dr. Anna, sir. I hope you keep us blessed with your experience and look after the ASSOCHAM initiative of trying to eliminate tuberculosis. Now I move over to Commander Navneet Bali, who is also the co-chair for the Healthcare Council of ASSOCHAM, and he's also the director, Narayana Super Specialty Hospital. He has a master's in finance and management, and he's going to talk about the commitment that ASSOCHAM is going to do along with the other bodies. Over to Dr. Bali, sir.
Thank you very much, sir, and it's an honor to be here today. Good morning, everyone. Um, we live in a fragmented world, and I think we have never seen a better unifier than COVID-19, where almost the entire world has come together, and we have never seen a single factor uniting the world like COVID-19. And what it has also done, that it has brought the topic of health on our tables. It has brought the topic of health in our offices. We are today ready to discuss health. We are ready to take on initiatives. And we think that it is very, very critical for a country to look at health in its entirety. As far as the TB program is concerned, I think what is becoming more and more apparent now is India's intent and India's resolve to somehow control this disease across our great nation. One thing that we have learned in COVID-19 is that no one single entity will be able to do something if you really, really want to do it on a scale that our country deserves. And so it is important for government, for the corporate world, I mean the private sector and the public to come together. It's very important because we need to cut down the cost which the healthcare infrastructure, the cost of tuberculosis, if it remains in the society on our healthcare infrastructure, which then the money can be used in much, much better way. As far as the corporates are concerned, and as far as personally at Narayana Health, you all are aware of Dr. Devi Shetty's vision about women. I think he talks about them in almost many of his addresses. And as it was said in the beginning, a healthy woman brings in a healthy society. And I think I want to include the entire population here. And also this thought about tuberculosis being a disease of the economical weaker section has to completely now move out. The discussions, the deliberations, the pledges that we take today should not remain on the paper. They have to move into the corporate world. They have to move into discussions in the boardrooms. They have to move into how corporates can now look at tuberculosis not only in their own workspaces, but also I think we have a great responsibility of spreading the awareness, of taking this program into our own specific areas of operations. We also need to look at it in a very, very clear fashion, which includes the preventive steps, which includes in early detection, and of course in the line of treatment which already exists. I'm very, very glad that Narayana Health and ASSOCHAM in particular, we have been at the forefront of not only pledging but also moving in a direction which will bring the scourge of this disease down in India as the years go by. Thank you so much. The resolve of my own organization and of course as a co-chair of ASSOCHAM is absolutely to look at all avenues available to be a part in this great journey. I would now hand over to Payal to show a presentation of the pledge signing by the corporates. Thank you so much.
Great. I think that really calls for a big applause. So many corporates, coming up and rising to the occasion and signing the corporate pledge. Commander Bali? Hello?
Yes, sir. Over to you, sir. I'm done. Thank you very much.
Thank you. Thank you once again, Commander Bali, and we really acknowledge the role Narayan Hirdyale and you all are doing in the field of healthcare. We are all proud of you. And now we have the honor of having a very experienced person in healthcare from the Central TB Division, Dr. Rajendra Joshi, who's a DGD tuberculosis, and from the Ministry of Health and Family Welfare, a very experienced man involved in the management of communicable and non-communicable diseases, has many articles and publications to his credit. And I request Dr. Rajendra Joshi to tell us about the government initiative by the Ministry of Health and Family Welfare towards the common cause of eradicating tuberculosis. Over to Dr. Joshi, please.
Thank you, sir. Good morning, all. It's a privilege and a great opportunity. So I thank the organizers for giving me this opportunity to part of this important event. It is great to see that an association like ASSOCHAM is taking the leap in mobilizing their member companies to join the fight against TB. As our previous speakers and chair has alluded to, we have a very ambitious target of eliminating tuberculosis by 2025 in our country. It is definitely achievable. Have proven our capacity to react and achieve things in polio, in COVID, and definitely this is achievable. But for this, we require the support of all to achieve this target, and definitely the National Tuberculosis Elimination Program fully recognizes the crucial role that corporate sector can play in reaching everybody, both their workers, communities, and their surrounding communities also, and also to bring the expertise for identifying simpler and efficient solutions for fighting the TB. In tuberculosis, we face some challenges which look very simple, but which greatly affect the program. For example, delay in the diagnosis, like one of the, I think, madams alluded to earlier, that people are not aware about the symptoms. They don't come to the system, whether private or government. So there is a significant delay in the diagnosis, which not only affects the patient, it also, the patient spreads it to the near and dear ones and also to the co-workers, because tuberculosis is an infectious disease. So creating awareness definitely in the workplace and in the community is a major thing. Secondly, tuberculosis is eminently curable, but we require the patient to take treatment correctly for about 6 months. So the treatment adherence is another challenge. And here again, the corporate can support greatly by implementing the interventions at their workplaces. There is another aspect to tuberculosis, there is a social aspect, there is a stigma. So again, the corporates can support in educating their workforce and communities and facilitate to remove by counseling and creating health awareness, by removing the stigma so that the patient is not only cured, but is not felt inferior in any way. Other than this, we can also, corporates can also partner with the program in setting up health infrastructure, access to TB screening, testing facilities for their employees and in the general community also. So I am very happy that many people have already taken the corporate pledge. I request the others to help us by supporting. Investing in tuberculosis is not just social cause. It also helps the corporations by giving good returns, because it will reduce the absenteeism, it reduces the healthcare cost, and it also gives them a moral to the boost to the workers. So on behalf of Central TB Division, I again thank all the organizers, ASSOCHAM, Union, USAID, and other partners, and extend from Central TB Division, we extend our full support to the corporate sector in facilitating these processes. So I'm really look forward to working closely with the business associations and the corporate sector at large. I wish this webinar all the success and looking forward to very fruitful discussions. Thank you, sir. Over to you, sir.
Thank you. Thank you, Dr. Joshi, sir. Thank you so much once again for the phenomenal work all of you are doing for this very important cause. I think I would say that of making our country healthy and getting rid of the tuberculosis. Now, Dr. P. Ashok Babu, Joint Secretary Tuberculosis, is unable to join us, but he does send his good wishes to us. And with this, I move on to the inaugural address. I would request Shri Shripad Yeso Nayak ji, the Honorable Minister for State and Tourism, Government of India, to give his inaugural address. Respected Shripad ji. Payal, can you play his message? Thank you, sir, for your encouraging words. With this, I would like to thank everybody who could take time out of their busy schedule and join us and are continuing to give their wisdom to us. I think when, all we were in the medical school, we were talked about, prevention is better than cure. And the time has come where we must realize that health is the true wealth. And our focus should shift from illness to wellness. A rupee spent on prevention can save hundreds and thousands of rupees, which are spent later on sickness. So I am thankful to ASSOCHAM, thankful to USAID, thankful to the union for this initiative of stemming tuberculosis at the roots, early diagnosis and treatment. Thank you once again. And with this, I hand over the mic to Payal and Shadabji. Shadabji, who's the Senior Manager Corporate Partnership with the union and the man behind the show, who's doing all the hard work to eliminate tuberculosis in our country. Shadabji, over to you now. Please take over.
Thank you, Dr. Kalan. Thank you for your leadership and guidance. And thanks to all the ASSOCHAM members and leadership for their support in this fight against TB. Basically today I'll be talking briefly about the uh, corporate TB pledge, but I just wanted to confirm with Payal and Shrija if there is anything else before I start my presentation on the agenda.
Sir, you're good to go, please.
Shadab, go ahead, please.
All right, thank you. So I'll briefly talk about the corporate TB pledge because since morning we have been hearing about the corporate TB pledge, what the initiative is and what we are doing under this. So basically TB, we have heard enough about TB in terms of the loss to life. So more than 1,200 people die due to TB every day in our country. But that's also leading to not only in terms of the human life loss, but the economic cost, because most of these death, if you see 83%, more than 80% of the people who are getting TB, they are in the productive age group, which is 15 to 60 age, 60 years of age. And that's where the problem lies, that it actually affects absenteeism, medical cost, and premature death, leading to 170 million work days lost annually to India. And this overall translates into 13,000 crore dollars to economic cost to India every year. And this is the kind of impact TB has on families and the economy overall. So basically with this, because this is primarily in the productive age group and there's economic cost, so the role of corporate sector becomes even more important. And this cannot be, TB elimination is just not possible because the reach among workers is not feasible for us and for the program without the active participation of corporate sector. The resources, whether technical or financial, the domain expertise, whether it is related to infrastructure, IT, supply chain, or even manufacturing a diagnostic tool or simpler kind of drugs and other solution, health facilities. So corporate sector actually brings what it requires to deal with a disease like TB in a country which is diverse and which is huge like India. So corporate sector is the way forward in terms of if we really want to make progress and if we have to reach there by 2025. But we also realize that until unless we have top leadership and some kind of inspiration for the companies and for us to really lead, we will not be able to mobilize that kind of interest in the corporate sector. And with this idea, we approached Mr. Ratan Tata, Mr. Amitabh Bachchan. In 2015, we were able to get their support, and they were kind of very, very happy to lend their support. In 2015, we organized first corporate consultation, corporate dialogue in Mumbai under the leadership of Mr. Ratan Tata with various companies and also top leadership from the Ministry of Health. And this is how all started this engagement process. During the process, we also realized that this engagement with corporate needed to be systematic and formalized. And this is how the idea of corporate TB pledge came in. And we designed, and the government of India and USA jointly launched the pledge in 2019 with three simple objectives. One is basically creating awareness among masses, particularly the workforce and the communities around, on TB as a curable disease. That's something which we really wanted to do. And second is leveraging the CSR resources of companies and other resources, and then support them in a way to kind of do systematic work, which is complementing to the program and as per the guidelines of the program, and at the same time recognize their good work, which is being done by companies in various fields of TB. So what is corporate TB pledge? It's a pledge where basically we have 4 tiers, silver, gold, platinum, and diamond. And based on your commitment, you can choose how much you really want to get into, whether just basic awareness activities, or you want to invest resources, or you also become champion, like ASSOCHAM has become a champion, and they are mobilizing other companies to join the pledge, and they are leading it from the front. So as on date, we have around 140 corporate partners and 10 business associations, and ASSOCHAM is our leading partner among the business association category. And there are we really look forward to how many more, considering the size of our country and considering the timeline which we have by 2025. So some of our corporate partners who are doing meaningful work on ground, sorry, we cannot have logos of everybody. We try to do as much as we can, and at various forums, we try to keep this slide changing. One of the important activities under corporate TB pledge and what corporate actually can do and what we look forward is the workplace intervention, TB and workplace. This is something which we really look forward. So we request every company to at least, if you have a HR person, if you have a medical officer, at least to have either a committee for TB and workplace or at least some focal points for TB and workplace. Build their capacity, which we can facilitate along with the program, and then they can organize awareness and periodic screening at the workplace. And then whosoever are found to be having active TB, they are supported in initiating treatment and in completing treatment. And this should become an ongoing process so that TB is not there. And if there are individuals, they are put on treatment, so the transmission of the virus can be minimized, and we can lead to making the TB-free workplaces. Some of the photographs are corporate partners doing a lot of activities on workplaces, whether Apollo Tyres, Ambuja Cement, Goodrich Tea, Adani Group, Best Mumbai. So various companies are taking steps to ensuring that their workers are aware about TB, they are screened regularly, and there is access to treatment, and they are supported in completing the treatment, and there is no stigma related to TB at workplaces. Related to CSR and other interventions, so we can certainly look at possibilities. You can adopt certain states, you can support this kind of a state level brand ambassador for TB, organize high visibility events, sports events to create awareness on TB, support mass media activities. Similarly, you can adopt certain blogs and do awareness, community mobilization. In terms of diagnosis, delayed diagnosis is a problem, and that's where we need support in X-ray. So you can support like X-ray voucher, mobile X-ray facilities, mobile labs, including CBNAT or fixed lab in partnership with the program. And then you can adopt certain geography and do 360-degree kind of projects around your plants, around your CSR areas, which do awareness, screening, sputum collection, transportation, and treatment adherence. In patient support, there are a lot of things which are required, but one of the emerging things is training for the cured patients. Some patients might require reskilling and might look at changing their previous profession from the heavy labor to some simpler activities. So you can support in skilling activities, digital treatment adherence tools. You can support in designing such tools, treatment education for patients, counseling and technician support, and then the nutrition support for patients in TB. So these are all different activities which you can choose, and we have ready-made costing available depending on the volume you want to go into. These are again some of the photographs of activities, from the screening to awareness generation to nutrition support by Niara Energy in Gujarat, HP doing the screening in their OPD, GAIL supporting a 360-degree project in UP, Medanta mobile X-ray van in Haryana. Now they have also started a project in Delhi with Delhi government called TB-free night shelter. Corporate TB pledge members also have access to what we call online platform, which was launched by the Union Health Minister on 24th March 2021. This has digital solutions. You, by becoming CTP member, you have got the ID and login and password, and then you can have access to information you connect with other partners, other corporates, and then you can seek technical support. All this is available to all CTP members. This is particularly useful in times of COVID when we are not able to really reach to you in person. Then you have all the access to information and technical support through this digital platform. Corporate TB pledge work has already been covered very well in the India TB report, which is released by Central TB Division every year. So 2020 and 2021, it was very well covered, and we hope to have similar coverage in report 2022 as well. So as I said, recognition was another important objective of corporate TB pledge. So corporates have been getting due recognition by the top ministry officials and the ministers at various forums. So we have got Medanta, Fokia, which is the Federation of Kutch Industries Association in Gujarat, another regional business association who is doing very meaningful work in Kutch region. Apollo Tires, Johnson & Johnson, Best Mumbai, Niara Energy. And every quarter we organize Hall of Fame for the corporate TB pledge member. They send their entries, and there's a provision every year, every quarter, 2 corporates are selected for this kind of recognition of their work. So broadly, this is about the corporate TB pledge, and there is availability of technical support to you in designing, in training, in IEC materials for you by the union, by the program. We facilitate with the connect with the state government, district health department and TB program for free access to diagnostics and treatment services. There is provision of rupees 500 monthly for TB patients for nutrition support. So there are a lot of things which are available, and it's just about your leadership, your intent, and sparing your people for those awareness activities to really make TB-free workplaces, to also take this message to communities, integrate TB messaging into your CSR work, and initiating some services into your existing medical facilities. If we can do some of this or more of all of this, we can certainly contribute to the program in much better ways, and it can really lead to making our workplace safer, TB free, and our country TB free. So we really look forward to welcome all of you to join the corporate TB pledge and working with you closely. Thank you.
Thank you so much, Shraddha. And now we would like to go on to the key session of today's webinar, that is the panel discussion. I'm extremely honored to welcome Dr. Neeraj Nishchal, Additional Professor, Department of Medicine, AIIMS, Delhi, who would be moderating the panel discussion. Dr. Neeraj's work in the field of infectious diseases with special emphasis on HIV and TB has been phenomenal. We are privileged to have him steering the panel discussions today. And with that note, over to you, Dr. Neeraj Nishchal, for taking over the panel discussion. Sir.
Yeah, thank you, Srija, for nice introduction. And of course, with all the discussion which has happened so far and all the talks which people have given so far has made my at least introduction part of the reason for organizing this panel discussion easy for me. So today we are going to discuss about corporate engagement is a successful strategy in various developmental areas. Can India achieve the ambitious target of TB elimination by 2025 without the active participation of corporate sector? That is the question which we have at the moment. So we all know that the role of industries, which has been instrumental in eradicating disease like polio, which is a well-known fact. And apart from that, corporate sector has been playing an active role in programs like HIV and AIDS program of the country. That has been phenomenal so far. So there has been numerous evidence on private sector engagement in the fight against disease like polio, for example, Rotary, HIV and AIDS, Apollo Tires, and Transport Corporation of India, which actually played an important role in reaching the vulnerable population, the trucker community of the country, which are thought to be the most vulnerable population as far as HIV and AIDS are concerned. And then again, DCM Shriram, Hindustan Lever, again, they all have been working in the corporate responsibility as far as HIV and is concerned. And in the previous presentation, we have seen that they are coming in a big way as far as supporting TB program of the country is concerned, which is a very encouraging sign. So since the applicability of CSR provision of 2014, the CSR spending by corporate India has increased significantly. A major chunk of this fund has went into health and education. And in health, the major emphasis has been on the Swachh Bharat Abhiyan and the reproductive, maternal, neonate, child, and adolescent health, which is important. So according to a survey, companies spend around 47% higher in 2018 as compared to 2014-15, contributing to roughly 7.4 thousand crores to CSR initiatives. Further study of CSR spends by the companies in the country in last 2 years suggests that there has been a shift in focus from pre-decided plan framework of CSR to activities related to fight against this COVID-19. Again, this COVID-19 has been with us for last 2 years, and it has in fact hogged the limelight, and all other diseases have been neglected because of this particular pandemic. Of course, this is a serious problem, but at the same time, we have to remember that other diseases, particularly infectious diseases, play havoc in our society, and they are taking lives of the most productive age group people. So we have not to lose our focus because of COVID-19. But as far as tuberculosis is concerned, I will say we should not blame poor COVID for all the ills which we have as far as TB CSR is concerned, because even before COVID-19, the spending on TV program has been poor as far as corporate sector is concerned. So why corporate sector involvement is important? Because TV, again, we all know that it affects the productive age group, and these productive age group go to their workplace. So even if the healthcare health sector want to get hold of these people, it's really difficult without involvement of these corporate sectors. So corporate with their reach and infrastructure can support the program in aiding and establishing mechanism at workplaces where, of course, they can contribute in ending this tuberculosis by 2025 as visioned by our Honorable Prime Minister. They have access to the workers, communities supporting infrastructure in form of resources, and of course through their CSR and other awareness programs, they can definitely help in achieving this target. So with this background, I'm happy to introduce the great panel which we have for discussion today. They have vast experience in public health and especially tuberculosis program. So the first panelist is Dr. Raghuram Rao, who is Joint Director, Central TB Division, with vast experience in the field of public health, especially tuberculosis and HIV program. Mr. Chandrasekhar Sibbal, who is Senior Vice President, Fusifilm India Private Limited, which brings about the various gadgets which we require in diagnosis. Dr. Ravi Gaur, who is Director and Chair, Medical Advisory Committee, and OneQuest Lab Limited, again important partner in diagnosing TB. Dr. Rohit, who is Medical Director of MSD. Dr. Blossom Kocher, who is co-chair ASSOCHAM Empowerment Council and chairperson Aroma Magic, and of course our Dr. Kuldeep Sachdeva, who has been part of Central TB Division for long, and now he is Regional Director, the Union Southeast Asia. So without wasting time, I will start the panel discussion. And since we have been told that the session has to end latest by 1 p.m., so I will request the panelists to stick to point. Of course, we would like to listen to them, but 5 minutes is what we are expecting them to stick to that timeline. So my first question will be to Dr. Raghuram Rao, who is Joint Director, Central TB Division. Sir, we would like to begin with you. What is your take? Especially, do you think India can achieve the ambitious target without active participation of corporate? And if no, what is it in for corporate sector? Why should they be contributing to this particular program? And also, according to you, what are the possible roles they can play?
Thanks, Dr. Neeraj, and thank you, ASSOCHAM and all the organizers for this session. And greetings to all my co-panelists. With your question, Neeraj, I think definitely yes, because if we have to achieve this ambitious target, then we need to have a whole of society approach. It cannot be just handled by the health, sector alone. And TB is not just an illness, medical illness. It's a social disease, and a lot of social determinants needs to be addressed. Be it poverty, be it living conditions. We have seen in the entire Western world, if they have achieve TB elimination. It is only when the country and the society as a whole, as it develops, the TB disease starts coming down. And everybody has a role to play, be it the healthcare provider, the state or district administration, be it the society, the industries, and the corporates. So the corporate sector has a very, very significant role, to play, and considering the reach, the workforce that they employ, the expertise that the corporates have in hand, and it's essential that we reach the communities with messages on awareness and prevention activities, diagnosis, treatment, all this information to reach out to the society and to the workforce. The corporates can make can play a very, very large role in that, and helping us build a healthier society. And the program duly recognizes this role that they play, and like many occasions such as today, we work with the corporates through our partners, union, and all other development partners who are supporting us. And corporates can play the role in two parts: one, what they can do within their workforce, and what they can do outside. And within the industry, what and the workforce, what corporates can do mainly is to spread the message, help periodic screening and testing at the workplaces, help provide easy access to TB treatment for the patients from the workforce, and support them in making sure that they adhere to the treatment, they have their regular follow-ups done, any support at workplace, at home, that is required for making them to successfully complete that treatment. Of course, ensure that there's a stigma-free environment in the workplace. That's very, very critical, for a person to successfully complete treatment. This is one very significant way that the corporates can play, industries can play in their workforce and in their settings. And apart from that, they can also partner with the district administration, with the state, in helping set up the and strengthen the health infrastructure, increase access to TB diagnostic screening at the community level, and bridge any gap in the health infrastructure that can be done. Various examples were presented by Shadab when he was making his presentation just before this. So basically saying that when we expect the corporates to play a role, if they invest in TB, it gives returns to them, in terms of a healthier workforce, reduced absenteeism, medical costs that they will bear for their workforce reduces, and there are lots of challenges which can be addressed at the workplace. So it's very, very critical role that the corporates can play. So that's what I would want to share today. Thanks, Neil.
Thank you, sir. The most important takeaway, I will say, it's a social disease, and we have to look the various aspects which can be taken care by the corporate sector, whether how to deal with that, and we will deliberate further on that. So next, I will invite Mr. Chandrasekhar Sibbal, who is Senior Vice President, Fujifilm Private Limited. So, sir, my question will be, we all know that Fujifilm is a pioneer in innovations for screening of various diseases. Since time, we have been seeing that. You have a portable X-ray device, and recently you have also demonstrated a project on mobile X-ray on ground, which is being implemented in various states. So we would like to know that how can Fujifilm go beyond screening support to the program and help in improving testing and reaching?
Thank you very much, Dr. Nishchal, for a brief introduction. And as you know that, and thanks first of all ASSOCHAM, Union, and USAID, and Payal Swami, and Dr. Upasana, Dr. Sudhir Kalhan. So the TB prevalence is there in India, and everybody knows that the magnitude of TB is very high in India. So as a Fujifilm India Private Limited, we have started a campaign against awareness about the TB program. And now we have more than 50,000 installations of CR systems and DR system across India, not only in the bigger cities, but even in the smaller villages also, we have our X-ray system installed. And we have now done the introduction of our X-Air, which is a portable X-ray device, which is only a 3.5 kg weight. It's like a camera device, and it can go to any nooks and corners of the country, and we can have the X-ray done for the patient. And with the support of AI, artificial intelligence, we can try to detect the TB at an early stage. And this device is also approved by WHO. And right now we are doing a program with the USAID as well as Union, and our van is going to 27 locations and all the slum areas, factories. So we are going there and we are screening the patients. And this is a very, very successful thing. And we are going to expand this program further for other areas. Like we are going to expand to Darjeeling for the tea plantation people there, as well as then we have also plans to launch a TB lamp, which is a urine test, and for it has a very high sensitivity for HI positive patients. I think the work which sir you're doing, Dr. Nishal is doing, and this is a 99% sensitivity, and immediately now you need a sputum, and then sputum goes for a further evaluation for a molecular testing. But now, and it will take few days, but immediately with the urine test, you will be able to know with the point of testing device, the HIV positive 99%, and for HI negative patient, it is 65% sensitivity is there. So this test will be very good. We are going to now start some work on CDSO for getting approval for making this, for starting this device, selling this device in India. So we are working on that. Then we are working on AI for X-rays with the help of Cure.ai for early detection of TB. And also for all our X-rays and DRs, we are putting some softwares for early detection of TB, and also trying to create awareness among the doctors as well as the patients, and doing a lot of seminars on, and we have done the seminar with the Yashoda Hospital, and Dr. Upasana is the one who started that, and then Subharti Medical College. So overall, we are trying to expand our limits for early detection of TB, because we understand that TB is a problem not only for the poor classes, but even for the doctors. Even my home also, my wife got TB. She is a doctor, and it was very difficult to detect that also, because there was a differential diagnosis, sarcoidosis or TB in between. A lot of problems were there. And then Dr. J.C. Suri from Safdarjung Hospital, we got there, and we got some kind of a resolution that it is a TB. So we understand, and everybody of us understand. My friends also got some TB. So we understand that TB can happen to anyone of us. And a lot of good programs for like TB and workplace is a very good program, which today I've got to know from Union, and awareness among our office and our colleagues will help us further on that. So, and we will leave no stone unturned, and we are going to invest a lot of money on TB for early detection of TB, as well as do a lot of programs and create an awareness for the TB detection. Thank you very much.
Thank you, Mr. Chandrasekhar. But I will just take a follow-up question on this. Okay,
yes,
most things we are focusing on pulmonary TB. You are talking about that.
Yes.
What is your company doing as far, because TB is just not pulmonary TB. There are other organs which can be involved. So how is your company actually looking into that aspect as well?
So right now we are focusing on the pulmonary TB. And we are also making some softwares for the COVID also, that pneumonia, that COVID pneumonia softwares and other softwares also with the CT. So because we have the radiology equipments, we have X-ray equipments, radiology, CT scans. So right now we are working on that. And as I told you, the TB lamp, which we are working for HIV patients, and it has a low sensitivity for non-HIV patients. So we are working on these few things as of now, and mainly the X-ray part. X-ray is our major focus, sir.
Thank you, sir. Thank you very much.
Thank you very much, sir.
So I will invite our next panelist, Dr. Ravi Gaur, who is Director and Chair Medical Advisory Committee, OneQuest Lab. He is a well-known pathologist with mainly oncopathologist, and he is expert of various international organizations as far as lab societies are concerned. So, sir, I would just like to know your views as on, do you think India can achieve this ambitious target of TB elimination by 2025 without active participation of corporate? That is our main question. And also, as you represent a lab, I would like to have your view on why large industries can look into creating awareness among their employees and communities on TB. How, as a lab, can you look at supporting these large industry in testing and screening facilities?
Good afternoon, everybody. I think good afternoon, Dr. Neeraj. I think it's a pleasure to be here in this forum when we are talking about the tuberculosis. prevention of tuberculosis, basically. Rather, in fact, it's time to eliminate tuberculosis. Uh, in fact, this is a very important topic, what we're talking today, because, and I think let's thank ASSOCHAM. I'd like to thank USAID and, of course, the union also to take up this cause. The first and foremost thing, what the first question was like, do you think that India can achieve the this ambitious target of eliminating by 2025? I think at the start of the session, I think this program today, Dr. Sudhir Kallan, who was the chairman, he mentioned very important thing. Have we focused on tuberculosis? What we have done in COVID, I think we could have definitely eliminated. I think, the way kind of focus which has gone for last 2 years on COVID, and we have actually covered all aspects of this thing. Not only the diagnostic part, I'm from diagnostic field, but the treatment part, awareness part, involving the NGOs, involving the offices, the hybrid working culture, the hygiene habits, creating infrastructure and adding, the drug devices, manufacturer, regulatory authorities, quality accreditation. I think everybody has worked in a strong, harmonized together. So I think that's something very, very important. Had we done this for tuberculosis, I think we could have definitely eliminated it by now. But yes, I think better late than never. It's important to do that. I think we definitely can look into this because India, TB continues to be the India's serious health challenge. And all alone, a healthcare company or healthcare delivery hospital probably may not be able to do this. We require a harmonized multi-sectorial response. We need to involve everybody possible, wherever possible. Now, the first and the very important thing is firstly the find TB and then cure TB. The find TB is something which is like very, very important, and that's where, how do you find TB? Because firstly, you have to create awareness. The corporates can definitely help in a big way by creating an awareness program with a very large scale. And that's where we should be. They product all the corporates. I'm her diagnostic. I offer all kind of a preventive health checkup. Even the Fuji, they're talking about X-rays and very new technologies, and everybody. I think they market the product very well. I think if that means they know how to sensitize the public and the consumers and the audience about the product. I think that strength they can definitely use. And India, 60-70% of healthcare is still provided by the private providers. So I think private providers, corporates, various corporates, they normally work, and many a time they have the TPAs or insurance or medical cover arrangements with the hospital. Probably some important kind of the marketing awareness program can be driven, and that's where I think corporates can play a very, very important role. And alone government cannot do it. I think it's time to probably rope in and make a strengthen this resource. And there's a lot of resource in the corporate, I'll say that. The first and foremost, what I said is the awareness. Now, awareness can be in the mass public scale. It could be there in the camps. It could be done within their workforce. I think today what we're lacking is, I've seen multiple corporates, I've worked with various. I think there's no uniform corporate communicable disease policy. We have a lot of policies with us. We have SOPs, employee benefit policy, canteen, everything. But there is nothing like corporate communicable disease policy, which has of late come up in COVID. Now, of late in COVID, everybody is aware. You enter the office, firstly, they sanitize your hand. Are you coughing? The HR notices that. Then there's they have a checklist over there. They note the temperature. So probably if we create these continuous processes and little modified, and use of what we just heard from the use of AI, probably some kind of a AI analytical triage can be done right at that point of time. Probably we will at least nothing but create a awareness, but let's not create access so that people don't get scared out of it. Oh, I will not cough and I will not come inside because they suppress this thing. Let's not do that also. So I think some kind of work, very, very, HR along with the employee and the healthcare providers of the companies, they need to work together and create a very, very, nice corporate communicable disease policy, and keep it very clean to that kind of a thing, like, is a privacy, confidentiality, all has to be maintained and very well. Number two, probably another area we can work on is the clinics, because can we do a program? Because I think people avoid now. I think going to the clinics and all kind of it. When we have some health screen programs or clinics right in the various corporates, they do have, but many of them don't still have. maybe some weekly, monthly. And lung health is another area which has come in COVID too. So people now are aware of the lung health, pollution, respiratory disease. So let's utilize and use this opportunity to sensitize people. Look, this is COVID, it's fine. COVID is just come and will go, I'm sure. But TB has been there for long. It created a lot of damage. It can become active today, it can be latent today, and latent can become again active today. I think sensitization is something which is probably, when we work on that, I think that will work. Now, that's something. The second question, what you asked the diagnostic company, I think today there is a need for, there has been a lot of work actually happening on a rapid testing, because otherwise conventionally you have culture, and culture take 4 to 6 weeks. Probably by the time you lose a patient, you require, I've seen in northeastern country, part of the world, some areas or strong industrial area where maybe much hotspots are there, you cannot wait for 2 days. You have a patient today, you have to wait for 2 hours and give the report. Otherwise, they just walk away and they will never come back to you. The biggest challenge in TB is the missing patient. Patients have come and they're gone. You're missing those patients. They're not there. Then tracking is difficult. So can we make some kind of a, like we have an honorable Prime Minister program, National Digital Health Mission program, where all the tracking can be done via alerts, apps, informatics, tagging, iCards, annual screening program. I think private, and then the corporate can adopt and pilot and mentor the geographies here and nearby. So these kind of a tracking or health kind of a cards can be done. So then the Gene Expert, the new test which has come, like is there, of course. But TrueNat, another instrument which is there, they give reports in 1 hour. They're chip-based kind of a technologies. Probably, yes, all this TrueNat is an instrument which can be actually kept anywhere. It doesn't require any safety kind of just very little of safety precautions. Probably bigger corporates can have the instrument right inside their places and keep it. Anybody have the lung issues. Lung function test, probably, again, lung health. I think in Japan, there are, I believe there's a program which started by a male nurse a couple of years back, and they just have now, they have like shops outside which say, okay, they keep shouting, okay, test your lung health, because they smoke a lot. So probably something like lung health focus with small devices which can be driven by AI, which a breath kind of a thing, or maybe some, you blow into it and you can create some triage and screening programs, and that will create awareness. And lastly, if somebody has tested positive, let us not give them an adequate leave, adequate care, and make sure that our duty as a corporate is beyond the employee, for the families too and surroundings too. Why not make a trip out there and make sure everything is taken care of? I think these are certain areas probably we can work around, and that's something I'd like to add today. Thank you so much.
Thank you, sir. You kept a very important point, especially the adequate leave part, because in corporate sectors, employees fear taking medical attention because they will be losing their leaves and they may have financial problems. That's a very important point which needs to be addressed actually. So the next panelist I will invite is Dr. Blossom Kocher, who is co-chair ASSOCHAM Empowerment Council and chairperson Aroma Magic. So ma'am, I will just like to ask you, of course, the question will be again the same thing, will India be able to achieve without the active cooperation of the corporate world? And if no, how do you think that an organization such as yours can contribute to this fight against tuberculosis? Ma'am, are you there? Ma'am, you are on mute, ma'am. Ma'am, you are on mute.
Okay, now I'm fine. Okay, sorry. So I could say it again. Yeah, am I okay now? Hello?
Yes, ma'am. Yes, ma'am.
So I would like to thank you, Dr. Neeraj, for the wonderful introduction. And I would say it's such a pleasure and honor to be on this wonderful panel. And I would like to really congratulate ASSOCHAM and the union and the corporate for taking over this thing, because TB has definitely been a very, very big, it has been a very, very big problem right through the ages. And definitely, like we all know that it is one of the leading causes of death, and it has been there for such a long time. And of course, COVID gave it a backseat. But I also say one thing, COVID has brought it now to the fore, because while we were in COVID, we really went ahead like Dr. Go. All that you gave through, I think it was really wonderful. So we follow all that during COVID, and I think we should go through with that right through again and follow it right through, because this is something, since it is caused by, in the air, we have to really see if we can keep our masks on, or at least the hygiene followed. This is one thing we'll have to do. The other thing, it is something that is, since hygiene and thing is followed, we have to go about education. What we are doing today, we have to do it very, very often, because people forget. And this is something that is, it is not just a tax, a certain area of people or anything. Everybody, in fact, 48% of the population has this germ in them, and it is when they have malnutrition, or they have diabetes or other kind of diseases, and of course tobacco, pollution, then it comes up. And their immunity is the most important. And we have learned during COVID that immunity is something that we have to keep up. And even this is the same that goes with all diseases, and also especially with, TB. So we have to see that. And how can we keep on going? We have to spread it with education, and not just this, and going through and telling people. And we as corporates, really, we have to go in and not only look after those people who are working for us, but also their families and their children. And going further, this is something, unless we go ahead with it, I feel the government, of course, we can't say the government has to take it. We as a society have to take it, and we as corporates have to go ahead with it. Now, what do we do for this? One thing is, we've had TB, like I've said, right through. It's attacked different societies and different age groups. So we've had to look after it. And in our office, what we do is, one thing is, testing is very important, and testing has to be done not just for the workers, but for their families, and right through. Now, when we do have any problem that we come across, that they do have the TB, then now 20%, we've done a thing, 20% of whatever they earn will go on this thing. So they can't afford it. We have to see that we can get them treatment. And this treatment goes on minimum 6 months, and sometimes it goes on more, and it goes on even more. So we have to see as corporates, and that's what we do. We see that they get this payment. They can sit at home if they are ill. They can really take this. Their leave is not cut, and they are getting their money because they have been working for us. And I think who else is going to give them this treatment but us? So then after this, after we've done this, then we have to see if they can go on with that work, because we have, we have factories and others. If they can go on with that work, or they will have to be put to another part of the work. That is what we do. And the main thing that I have found, people don't like to come in for the testing, and they hesitate, they don't even tell. And we've had a few deaths because they don't tell us. They don't tell society. They are scared of rejection. They're scared they'll lose their jobs. So this is something we have to educate people that, this is a curable disease. It is a disease. And if you take the proper, you look after yourself properly, the proper, you will not get, any problems. So these are what we've been facing. The other we've been facing is children. When the children have TB, this is really sad. It's a little difficult for the diagnosis, and I'm so glad that we have all the wonderful labs that are coming up, and the different AI and the kind of technical things that could help them, because they have to be diagnosed. We have lost about 2 or 3 children in our community working for us because they were not diagnosed in time. They somehow They just thought it was just a fever, or they were getting sweats or something like that. They were just being tired. And when they did get the treatment, it was too late. So these are something that we really, I think, have to look into. And one thing I'd like to say, I'm all there for this eradicating of TB, because it touches every sphere of society and every age group. And unless we work together, we are not going to be able to eradicate it. And we have to take it on the COVID footing. Then we are going to help. We are going to be able to do it. Thank you so much. And thank you so much. It's been really wonderful listening to all of you.
So again, COVID has been giving us new means of communicating as well. So again, COVID footing in place of war footing is something which we need to apply in TB elimination program as well. Thank you, ma'am. So our next panelist is Dr. Rohit Gatule. He's medical director of MSD, which is again a pioneering I will say leader in providing the logistics and all this support which we need for TB elimination. So my question to you, sir, will be again, what is your view on this India's ambitious target of eliminating 2025 TB by 2025? And can you outline MSD's legacy in supporting this cause of eliminating TB? What innovations are in portfolio pipeline that you have towards this addressing these challenges in diagnosis and treatment of tuberculosis?
Perfect. So thank you, Dr. Nischal. Hope I'm audible. Yeah. So first and foremost, I take the opportunity to congratulate the entire team here for organizing this corporate summit and all the work done behind the scene by ASSOCHAM, USAID, and definitely organizing committee ably led by Dr. Sudhir Kalan. So real congratulations for that. So from MSD's perspective, MSD has had a long and ongoing commitment to fight infectious diseases. And specifically, I'll also talk about tuberculosis and how we've been doing that work specifically in this disease, which we're battling so critical in India. We also have a long legacy of making our medicines and vaccines accessible and affordable across globally, and same applies to our commitment in India as well. If I have to speak about our therapeutic kind of pipeline, in fact, the first antibiotic, which was the breakthrough antibiotic, which was streptomycin, was kind of under the sponsorship of MSD, led by the global company Merck & Co. In fact, I'll go back to historical background to this. In 1943, this medicine was discovered by Dr. Waxman and Dr. Schwarz, and the Dr. Schwarz and Dr. Waxman's research lab was supported by Merck at that time, and this was the first drug which kind of reduced substantially the deaths because of the tuberculosis across the globe. And as MSD got to know about its global importance, it in fact relinquished its patent. In fact, it gave away the patent for the cause of maximizing the patient access. So that's probably one of those commitments in infectious diseases which MSD has. We also have a rich legacy in vaccines research and a very broad pipeline in vaccines. We all know about BCG vaccine. This is the first vaccine which every kid, every human gets as soon as it is born, and probably very happy to also kind of get to know that to tell you everyone that BCG vaccine, which is a percutaneous vaccine, was also kind of first developed along with multiple kind of other companies which had research in it. But the TICE variant of the BCG vaccine was first developed by Schering-Plough, which is owned by Organon and Merck & Co. globally. So in fact, that's again one of our commitments from our side, that we and continue our research in vaccines also. And what better research can be there from apart from vaccine to kind of eliminate the disease? And we are surely hopeful that this is the way forward to kind of continue our part towards eliminating that cause. But the work doesn't stop here. In fact, we have made fantastic commitments furthermore. In fact, the Merck Foundation globally has done commitment from making certain grants, close to $7 million grants, which has been kind of in place from 2017 to 21 to expand a program called as Extension of Community Health Outcomes, which specifically works in chronic diseases like tuberculosis, even acute diseases like hepatitis C, HIV, then cancer, diabetes care, and mental health conditions. So that's a commitment from even foundation's perspective, and Merck has a very long legacy. And as rightfully said by all my fellow panelists today, it is kind of a difficult disease to treat. But lung health doesn't stop even only at tuberculosis. In fact, Merck's commitment to lung health, as rightly mentioned, that any space-occupying lesion in the lung can have differential diagnosis, which can be varied across diseases. And in fact, in lung cancer, we also have a very strong commitment from our immuno-oncology pipeline, which is pembrolizumab, and we have a very strong legacy there. So this is what I would kind of put to the table, that this is how we're kind of contributing from therapeutic options like drugs to vaccines to grants, and even furthering our cause to kind of supporting the good lung health care for the country. And open for questions at the later stage. But thank you so much again for giving us this forum.
Thank you, Dr. Rohit. And in fact, if companies start giving these drugs, even if they develop newer drugs for tuberculosis and they remove this patent aspect and make it available freely across the globe, I think that will be the biggest support one can expect from companies like yours. So that is very important. And next panelist, I would like to invite Dr. Kuldeep Singh Sachdeva, who has been at the helm of Central DV Division, and of course now as a regional director, the Union Southeast Asia. So, sir, you have been part of the national program. You have led that program, and now you are leading the Union in Southeast Asia. We have been talking about role of corporate sectors in eliminating this tuberculosis by 2025. But do you think just asking them to help us in eliminating without providing the technical aspect, what is expected from them, how they should be approaching this problem so that we can eliminate this disease by 2025? So that union has been a staunch advocate of engaging corporates in national program. We would like to hear your thoughts on the topic. And also, as you host the Corporate TB Place Secretariat, we would like to know how important is the role of technical support in tuberculosis, because you may give a tank to a person, but if he doesn't know how to fire it, then it's of no use. So that's why how is Union going to help with those technical aspects? We would like to hear from you.
Thank you, Neeraj. I think the right question you have asked. I'll split it into two parts. One, many corporates who work in the area of healthcare or associated industries, they have their own set of expertise, like Dr. Patule said, works with a corporate which develops new drugs, new vaccines, diagnostics, etc. I'll also refer to Dr. Ravi Gaur and Mr. Sibal from Fujifilm. So they have their own set of expertise, which brings which they bring on table. So this is a niche expertise which each of such company will have. Having said that, the approach to TB control, as Raghuram Rao also said, it's a whole of a government approach, meaning thereby you involve all stakeholders, both public and private, including individuals, societies, philanthropists, so on and so forth. So and he also alluded to the fact that TB is not only a medical disease, it is also a social disease. So ramification, its social determinants extend from poverty, housing, environment, sanitation, so on and so forth. So the expertise for addressing such kind of determinants across the board and making sure that the disease can be eliminated is a separate set of skills altogether. Having said that, we also know the history of TB control in India. 1950s, they launched a district TB control program, which was running for almost 30-40 years, but had no results, because there was not a focus on how the disease should be addressed from a elimination perspective. Building on from there, we say like we at the union are a 100-year-old scientific organization. So we generate evidence on how that evidence can be taken on scale to eliminate diseases which affect the country and the common man. So how we can support various corporates is in training and capacity building. We can train the policy makers or implementers or whosoever. I mean, either they're heads of who make policy decision or their implementers who do that. That's one aspect where we can support them. We can also give them technical assistance or act as an advisory where they can channel their own skill set which they have and the additional skill set which they need. I mean, we can give them those skill sets, try to transfer those skill sets to them. The third is the simpler one. If they want us to develop projects, we can develop projects for them. Or of course, it has to be a collaborative process, what they want to do, and how can it create a maximum impact. So what we will look at population level impact and the community level impact. So we can do handhold them, develop projects for them. We have a whole team which can support them. We have almost close to about 300 personnel working with the union. But what do the corporates get out of it? I mean, we can, of course, it's a clarion call and we say you work for the society, and that's where the CTD is also coming from. You work for the betterment of the society. But of course, we can help them in image management, brand building. We can help you to enhance your urge to do good for society, philanthropy. So all those skill sets are available within our organization and also with our partners. And we are more than willing to extend those support to any corporate or any individual or any group of individuals who are willing to make a change in the society. Over to you, Neeraj. I'll be looking at specific questions if you have.
Yes, sir. Thank you, sir. So you just said we have to incentivize the corporates for picking up these cases. So can we ask government, say, okay, if a company is picking up cases and because of that it is basically suffering loss of, I will say, monetary loss in terms of manpower, paying salary to a person who is not working because of that illness. Can we ask government to say incentivize this by giving tax relief for all this thing so that the companies may give leave to such people and help them in seeking medical advice?
So Neeraj, now that does not fall within the broad area of which I can address. Maybe from CTD, Raghuram Rao or others may like to address this issue. But that's a larger issue. The call is taken by stakeholders which are beyond, I mean, more central level policy maker. Of course, if there is a need for advocacy, we can do that advocacy. We may not be able to take those decisions. We can do advocacy for those decisions if there is a felt need among corporates for the same. But having said that, I also know the thinking on the other side where the policymakers and the government machinery actually looks at corporates to support their initiatives. So it's a both parties want some kind of incentives and other things. I think the only incentive here is a clarion call, but I leave it to Central TV division can also respond, and I see Mr. Sibal.
Dr. Ravi wants to give some input, I think.
I think I'd like to, very nice question you asked, Shrutishan, because I think it's very important to have, the tax exemptions on the expenses of tuberculosis. I think if you have this kind of some policy or something we can advocacy to government, that will definitely create awareness in the other people. If I am got tuberculosis, I am getting treatment, my expenses will be tax exempted. So I think that if at least not fulfill the part of the, because treatment are normally reimbursed by the corporates also. Generally, government also do a lot of free treatment. But this advocacy tax exemption, it itself could be an awareness plan which help out people. Look, TB, don't worry, it's curable, even in tax free. Don't worry about it. That's something very important question. I think we should definitely do that.
Dr. Co-Chair, yeah, please.
I agree with Mr. Gore. That is something that really is going to help us and help everyone, and it's going to take this program forward. It will be wonderful.
Yeah, from my side, I would say our basic objective is to, make sure that there is no out-of-pocket expenditure. And if there is an expenditure, we try to get that reimbursed so that, there is minimum expenses or no expenses to the patient. And giving a tax rebate, very interesting, to have that. It can, of course, it will go through different policy channels for doing that. But traditionally, in the tax rebates, it's about medical insurance, and the expenses towards medical insurances have a tax exemption of the premium that we pay for our medical insurance. There are certain schemes which have a tax exemption. Now, under which section of the IT Act where the tax exemptions, are being given, it's something interesting. We can convert that into a small proposal. I'll encourage, if any one of you can convert that into a proposal and send, and we can definitely, from the industry side, that this is a demand coming from the industry side. It will absolutely give us, a lot more teeth to push the proposal. So welcome one. Yeah.
So just as Sir said, medical insurance, again, that leaves a very interesting question. Can we rope in these medical insurance companies to incorporate a screening of TB before insuring a person? That can again help us in picking up those cases which are being missed. Can we think of something like that?
So there is that kind of advocacy is already going on with medical insurance companies and National Health Authority. I mean, Raghu will watch for it that we had sometimes back done an advocacy and also impressed upon National Health Authority. At least a beginning can be made where screenings can also be paid out of insurance. But I don't know what is the latest view and position on this statement. But again, I'll maybe Raghu would like to respond to this.
Yeah. In terms of that, there is already a concrete proposal that we have, working with the National Health Authority for incorporating TB screening packages in the PMJAY and in the insurance. And it's getting fine tuned, and we're designing those packages, fixing rates, and all those things. It's in that stage at this point of time, and hopefully it should see that. The challenge with insurance is that most of it is for inpatient, and very few insurance packages cover outpatient services. And that's where we are negotiating with them because most of the screening that we require in tuberculosis is all, which can be easily done on an outpatient basis. And we are working on getting to do that with them. Having said that, a lot of states, because PMJAY is a scheme in which states have this flexibility to add on packages, and at the state level. So a lot of states have added TB, testing and many other OP, IP packages in the state level initiatives. Be it Orissa, which has its own insurance package outside PMJAY, and Karnataka. Quite a few states have added packages already into it.
So Dheeraj, if I may just building on from there, and this is again, I mean, advocacy with the ASSOCHAM and other such associations, that maybe you can work with the insurance regulators and insurance companies to at least include them in their own package. This will also spur more teeth to government to negotiate with NHA that, okay, TB screening can be, or TB OPD attendance can be included as a CSR component in their insurance packages. Just an idea which is generated. It may take some time to mature, but that's a thought.
Any question from the
Michelle, one additional point which I wanted to kind of share. What we've seen is with entry of Ayushman Bharat, 2.0, the insurance segment has increased substantially, right? So probably we've seen implementation of tuberculosis program under Ayushman Bharat also very strongly. I'm not sure, but the question which you asked, is screening being done for every patient under that program, which is outside of tuberculosis? Maybe I think this is an important segment, because this is one of the largest programs ever done under the PMO's office. So I think kind of obviously the unorganized sector, which is like the section of which is privately held insurance, but I think Ayushman Bharat, which is centrally owned, will have a large impact at the country level if we can implement such programs.
Just one point I'll add here. What insurance you're talking about. There are a lot of patients actually who undergo tuberculosis treatment. They probably drop out in between. Probably we have a database, and insurance companies can pick up there. If you have a database and all those people who have completed their treatment for a time, probably next time when they go for a medical premium, they can be incentivize some kind of premium bonus can be given to them. That will help them to complete the treatment. Otherwise, many of them we have seen, they drop out after 3 months, 4 months, they're not regular in treatment. I don't know. That's one fake suggestion I would say that.
So any of the attendees have any questions, they may type it. We have around 5-6 minutes left with us, so we can take those questions. So I will just briefly summarize what we have discussed so far. The various panelists, the one message was very clear that it's a social disease. It affects the various domain in one's life, and that's why we have to be having a multi-sectoral approach where different stakeholders will have to play different roles. So whether it's drug development, the diagnostic procedure, the treatment aspect, the follow-ups, how to pick up these patients early, so that we don't miss out on those patients, those infecting other around them, or those who have extrapulmonary TB may be suffering from complication because of the delayed diagnosis. So we have to have lead time in diagnosing these patients so that timely interventions can be done. And of course, the corporate sectors have to be incentivized. They have to be made aware of what they will gain by taking care of these patients. That is something which we have to look for, and we have to think of out-of-box ideas, because after all, if we are decreasing our target by 5 years, we have to think out of box. And of course, COVID-19 pandemic has taught us if we all basically participate together, we can definitely achieve these targets. And sir, would you like to add something to that, Dr. Sachdeva or Dr. Raghuram Rao, on these aspects?
So, but the latest paradigm now in TB elimination is something like what they did for polio. It's population level screening. And various studies in other parts of the world have shown that if you treat all prevalent cases in one go, you also reduce incidence successively over the next few years. So if you can do that in 1 or 2 years or 3 years as a special burst or etc., you are likely to see an exponential decline in incidence, and which will actually build a lot of confidence and hope among TB programs and policymakers that yes, we are on the right track. And there is some thinking and some effort on that part, but it requires a huge support, a huge logistic, huge support, and huge what the earlier health minister coined the word Jan Andolan. So it's a kind of a Jan Andolan which is needed to reach to each and every household, screen them, treat all prevalent cases at one go, so that you see a decline in incidence. So there are enough evidence available from various studies in various parts of the world that it's doable.
Dr. Raghuram Rao, sir, do you have to add something to this?
Broadly, prevention is what is probably, the largest task that we will have in hand going forward, where a huge population, of ours will have latent TB, and handling that, because they'll be breakdown to TB going forward with, lesser immunity or as age progresses for many reasons. And the explosion of the NCD epidemic in the country will have its own impact on TB, where we have more breakdowns that will happen, and comorbidities death analysis of the program says that, maximum deaths happen when there is a comorbidity, with TB. And tuberculosis comorbidities, what we largely see is with diabetes, with, a lot of hypertension and ischemic heart disease. So as the population progresses, our life expectancy is increasing. But at the same time, we have a lot of non-communicable disease, spreading its wings. And tuberculosis has survived everything, from nuclear wars to disasters, and has been there for over 3,000 years. And within this, it's like an ample environment for it to start multiplying. So as we go towards elimination, not just finding all cases and treating all cases will help. It will help reduce incidence and transmission. But it will, if we are talking of elimination, then unless we address these two components and prevent new cases from breaking down, we'll probably miss the bus.
Yeah, thank you, sir. We are running out of time, so I will hand over mic to the organization. So.
Yeah, thank you so much, Dr. Neeraj Nishal. We have a couple of points, questions that have come up in the chat box, which I would request the panelists as we move ahead to just try to answer a few of them. Moving forward, on the same note, once again, thank you so much, all the panelists the discussion was extremely exciting. On the next note, I would like to invite Dr. Umesh Chandra Ojha, Director, Institute of Occupational Health and Environment Research, ESIC Hospital. And sir, we would like to know, sir, when workers fall ill, largely affected due to TB, what are the leave provisions or the wage lot provisions that is considered as part of the ESIC? What are the provisions available to them? On that note, I would like to hear from you, sir. Over to you, sir.
Good afternoon, everybody. Am I audible?
Yes, sir. Yes.
Yeah. So first of all, as far as ESIC is concerned, we must know it is a social security organization. And we have about 8,000 plus doctors and pan-India presence. So wherever TB patient comes to us, what we do is we diagnose the case, treat the case, give them appropriate leave, and compensate in terms of sickness benefit. Sickness benefit is in terms of monetary support for the whole duration of their ailment till the time they have not been able to start their job again. So give them full support in terms of all these benefits, monetary benefits and sickness benefit. As far as TB is concerned, we have a provision of giving extended sickness benefit, which is beyond 90 days or so. So we are supporting our patients. Roughly, we have 3.41 crores of insured persons with us, and add to it is approximately 13.5 or so crores of populations are covered pan-India with us. So whosoever suffers from TB in this group, we help them the best possible way. But fortunately or unfortunately, we are covering just the population who are insured with us only. That is formal sector. So which is about 10% of the Indian workers' population. Rest is with other industries and all.
Thank you so much, sir. Very insightful. And on that note, we come to the last part of this particular event today. It was such an honor for me to get an opportunity to thank all the dignitaries and participants at the webinar here today. On behalf of the Union, I, Shrija Nair, Technical Advisor, Corporate Partnerships at the Union, express my gratitude to all esteemed delegates of the webinar for their presence and contribution in making it a success today. A sincere thanks to Ministry of Health and Family Welfare, Government of India for their continuous support. My deep sense of thanks and appreciation goes out to all the participants who attended this webinar with great enthusiasm. A very special thanks to companies who have signed the corporate pledge here today. We have Dabur Research Foundation, Narayana Super Speciality Hospital, MSD India, Onquist Laboratories Limited, Tirupati Wellness Private Limited, Yashoda Super Speciality Hospital, Kaushambi, and Sir Gangaram Hospital join this event and commit to the cause. Thank you so much, everyone, for coming forward with this. And also, I would like to extend my sincere gratitude to our Honorable Minister of State for Tourism, Shri Shripad Yeso Nayak ji, for taking out time today from his busy schedule to grace the event. Thank you, sir, for inspiring and encouraging us with your words today. Our heartfelt gratitude to Dr. Rajendra Joshi and Dr. Raghuram Rao from Central TB Division for their continuous support and presence at the event today. I also thank Dr. Mrigen Deka, Mr. Ashish Verma, and Mr. Divakar who extended support in coordinating at the Central TB Division. A big thank you to Dr. Neeraj Nishchal for moderating the panel session so wonderfully, and panelists Dr. Raghuram Rao, Dr. Ravi Gaur, Mr. Chandrasekhar Sibal, Dr. Blossom Kochar, Dr. Rohit Ghatule, and Dr. Sachdeva for making the session so interesting and so interactive and interesting. A very, very special thanks to Ms. Sangeeta Patel from USAID India office for taking out time from her schedule and encouraging all of us today. Taking this opportunity to also thank Dr. Umesh Alavdi and Mr. Arvind Kumar for the immense guidance and support in making this event happen. I would also like to thank eminent speakers Padma Shri Dr. D.S. Rana, Srimati Upasana Arora, Commander Navneet Bali, and Dr. Umesh Chandra Ojha for their encouragement, support, and contribution in this event. A special thanks to Dr. Sudhir Kalan for steering the event and making it a huge success. This event today would not have been possible without the able guidance from leadership here at the Union, and especially Dr. Sachdeva. Thank you so much, sir, for your guidance and support. I would also like to express my heartfelt gratitude to Dr. Jyoti Jaju, Dr. Manu Matthew, Dr. Rakesh, Shadab, and all others here at the Union who have extended their support and cooperation in organizing the event. A big call out to Meenakshi ji from ASSOCHAM for her constant guidance. And finally, taking this opportunity to thank Payal and Ritika from ASSOCHAM for their unrelenting hard work and support in organizing this event. I once again thank all of you in making this event such a success. We look forward to many more ASSOCHAM members joining us in this fight against TB. Thank you so very much, all of you. Hope you have a great weekend. Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you. Thank you very much.
Thank you.
Thank you, everyone. Bye-bye.